With a second confirmed case of Ebola now in the United States, the question needs to be asked, are we ready if someone with the disease makes their way into the tri-state?
9 on Your Side reporter Bryce Onslinger spoke to local medical professionals to find out.
In the age of air travel, diseases can spread quickly, and while no flights from West Africa land in our area, that doesn't mean the medical community doesn't need to be ready.
94% of all flights from West Africa land in 5 U.S. airports: JFK, Newark, Washington, D.C., Atlanta, and Chicago. But the 2 cases of Ebola in Dallas prove it could come from anywhere.
It would start on the airplane. They have rooms once outside the airplane where they can put an individual or individuals that maybe are showing some symptoms, or at least that they need to do some more background questioning on.
Steve Devine is the Director of Environmental Health and Safety with the Northern Kentucky Health Department. It's his job to make sure CVG is ready for a possible case of Ebola.
At this point, we're not a focal point of this illness and don't expect us to be, but that doesn't mean that we shouldn't be ready, and that's what public health and some of these other community partners are making sure we are.
It was we would first put on this yellow gown.
Doctors like Janice Jones have been briefed on what to do if a patient shows symptoms of the disease.
The different mask that we would use in the case of Ebola, if we were concerned, and also when we talked about TB, is this N95 mask. And you can see that it's almost like a duckbill mask, and it provides much more protection than a typical mask otherwise would.
Using special equipment and a negative pressure room like this one at Mercy Anderson.
With all of the worldwide travel, it's a very small world now, and so it's definitely a concern that very quickly things could escalate.
If Ebola comes to our shore, as it has in Dallas, will result in minimal spread, if any, because we know what to do to stop it.
And that includes making sure school nurses know what to look for, something the Cincinnati Health Department is communicating this week.
For a disease that we hope will never come here, we are very well prepared. We try to learn from the mistakes of others, like in Dallas, where the individual went to the hospital twice because the note either wasn't conveyed or wasn't read from the first time.
You may also notice nurses asking about your travel history if you show up to a doctor's office with flu-like symptoms. That's a change being made to make sure no possible cases are missed. And right now on WCPO.com, you can read the steps that are taken once someone is suspected of having Ebola, from isolating the patient to testing at the CDC. Bryce Onslinger, Not on Your Side.